Good afternoon, everyone. Welcome back to our statewide lab advisory meeting. Second Monday of the month, every month. Thanks for joining us. It's a little after noon, so we'll kick things off here. Just some etiquette. Please keep yourself on mute. Feel free to jump off if you have a question or something like that. And a reminder to put your name and your facility in the chat so we can use that for attendance. Yeah, so we'll get started. So this meeting is being recorded. We'll put it up on the website when it's finished. And we'll start with any new staff introductions today. Do we have new staff to introduce? No one new today. Okay, so last month we introduced a new segment. We're going to do like a little educational clip during these meetings. Last month was Becky and Jeff on ticks, and this month we're going to have our very own Emily McCutcheon and Greg Beal talk about NPHL's new opioid surveillance program. So Emily, if you're here, I'm going to bring you on as a co-host. I think you can share your screen then.
Okay, thank you. Nope, I've got disabled screen sharing, so it's all you, Ben. And while you bring that up, I'll go ahead and start talking. Hi, everyone. I'm Emily McCutcheon. I'm the manager here at Nebraska Public Health Labs. And I believe Greg Bell is on as well. He's the supervisor of the chemistry section here. And we're coming on today just to talk to you guys about a new program that we're working on. And it's a pilot project that we're doing with DHHS. And we're really excited about it and the data it's going to generate for the state of Nebraska. So I know all of you are familiar with what we just went through with COVID, but one of the things that's been looming in the background during all of that is what's going on with the opioid crisis and how is it affecting the state of Nebraska? And the reality of it is that we don't really have the data yet to determine any of that information. And the reason for this is because the clinical laboratories across the state of Nebraska, most of them actually aren't testing for fentanyl, which is the top used opioid in their drugs of abuse screen. So if an individual reports to the emergency department with a suspected overdose and the physician decides to go ahead and order a drugs of abuse screen to see what they're potentially overdosing on, the number one causative agent of that is generally fentanyl, and it's not included in that screen. As you can see here, this is actually a toxic fentanyl study group quarterly report. This is something that I monitor regularly. And I believe the one that we're showing here is actually going to be Q2 of 2023. So this is the newest data. And you can see that bright orange sign at the top that says new clinical sites, Atlanta, Georgia, and Denver, Colorado. So right now, we are not participating in this study. It's something we're looking forward to doing in the future as we start to get this data in. But they talk to different facilities across the state or across the nation, excuse me. And they ask them to do exactly what we're trying to do with this new pilot project. And that's to take residual non-fatal overdose urine specimens, bring them into the lab, and we're going to test them on mass specs to determine what exactly that individual potentially overdosed on. As you can imagine, having that information is going to be extremely beneficial across the state of Nebraska so that we can go ahead and guide those harm reduction activities to try to limit the amount of overdose individuals walking into emergency departments. If we don't know what they're taking, we don't know how to fight it. So we need to start generating that data so that we can combat this. So Denver, Colorado just got added as a new site. So this is pretty exciting. So if you see the yellow bar there, they took these residual biological specimens from individuals exhibiting overdoses in the ER, and they tested them. And 90% were positive for at least one opioid, and 76% were positive for fentanyl. And if you remember what I just said, fentanyl is not generally included in the drugs of abuse screen. There's actually only one facility that I'm aware of in the state of Nebraska that now includes fentanyl in their drugs of abuse panel. And it is an add-on test that has to be specifically requested for. To my knowledge, and I really hope someone will prove me otherwise in the chat, no other facilities in the state of Nebraska outside of CHI Bergen are running this right now. And like I said, with CHI Bergen, it isn't a specific add-on that you have to request. It is not something that's automatically done. So 70%, 76% of those specimens are positive for something that we're not even testing for here in the state of Nebraska. And so when you look at the rank of Nebraska and the entire United States, it looks like we don't have an opioid problem, right? Because we aren't having any of these fentanyls pop up, not because they're not there, but because we're not testing for it. So that is the basis of this opioid biosurveillance pilot project that we're working on. We are now partnering with 2 major facilities here in the state or in the city of Omaha and hoping to expand on beyond there as we can. And we are going to test for 17 different compounds, including fentanyl and many fentanyl analogs, to determine what it is that these individuals are truly overdosing on, so that we can go ahead and help combat this opioid crisis, because it is here in the state of Nebraska, even though we don't have the data to support it right now. But we need to really see where we fall on that and what those compounds that we're fighting against really are. Does anyone have any questions on that? I don't hear any. So with that, I urge you all to look at the tests that are being performed in your emergency department, the tests that are being requested. Do they have fentanyl in them? Do they have fentanyl analogs? What are you truly testing for? Is it what is being seen all the way across the nation? Or is it only things that are going to be like heroin and things like that, more opioids? I also want to point out on this graph here that he's now showing, this is Q3 for 2022. Denver was not a location. So if we look geographically at the next closest, we have St. Louis, Missouri. Fentanyl was identified in at least 93% of their overdose specimens. 93% are positive for something that we know causes overdoses. We know how to reverse those overdoses, and we're not testing for it here yet. This is why we're doing this study. This is why we're trying to generate this data so that we can go ahead and help save some people from responding to the emergency department for an overdose situation. So if anybody's interested in participating in this, please reach out to me. I'll put my email address in the chat. We'd be very interested to hear from you and be interested in to hear what your facility is running in your drugs of abuse screen. Thanks, guys.
Thank you, Emily. Okay, so we'll keep moving. Yeah, expect a new topic of interest every month moving forward. We'll move on to NPHL client services. I don't know if there were any issues this month, anything that needs talked about or anything that needs fixing.
No issues. We are moving forward and eventually with our on-site label printing system, and that's still being worked on. This is a program that initiated by Robin Williams, and maybe Robin would want to say a little bit more about it, about its eventual implementation and how we're going to start and why it's important.
Sure. This is for the printing, the machines.
Yep, this is the little printer labels on site in our epidemiological locations.
Yeah, so we discovered that in an outbreak situation such as COVID, there was a lot of we had to collect a lot of specimens at one time, and they usually weren't at a facility. And so now we can, we've decided to get these special printers that you can, I don't know exactly how they work, and Brian or Scott Campbell might be.
So it is hooked up directly to the through the new alert system. And what it will do is print what we call an instrument ready label that has clearly identified the patient information. There's no handwritten interpretation. And this can be scanned when it reaches the client services department. And it makes the entire process of getting that sample tested and results out much quicker. Robin, you identified our public health departments in the state to begin with to kind of roll this project out. And so we're looking at the public health department. So we're going to start with the highest users. We have a list of the number of tests that each one sends to the public health lab. And those high users will begin with them, and as well as other programs within the state system like STI, hepatitis, things like that. And then eventually it'll be rolled out across the board to all sites, all public health department sites.
Yep. And so it'll make the throughput for specimen collection and sending and processing a lot faster. Hopefully, it's kind of a outbreak kit, as we're gonna kind of call it, to get specimens in quickly in case of a large scale outbreak. But can also be used in daily testing for public health.
Yep.
Very good. Thank you. If there's nothing else, we'll move on to the outbreak updates. If there's anything new, we'll start with Ishrat and the hospital acquired illness and antimicrobial resistance team. She's on.
Don't believe Ishrat's on.
think
She had a
she's here.
conflict at this time, but this is Lacey. Oh, and Dr. Ashraf's on, so he can probably talk more than me.
Go ahead, Lucy, go ahead.
I didn't know if you wanted to mention our one outbreak or not.
In general terms, so we are looking into a cluster of cases that are related to Candida prepsolosis at a healthcare facility. So right now we don't know whether it's a true outbreak or not, but there has been an increase in the number of cases from the baseline. So what they usually used to see versus what they are seeing now is kind of increased. So we're trying to figure out what the source of that is. So we're working on that at this point. So if somebody else have seen the same thing, like increase in Candida prepsolosis that was not there before, and now you're kind of all of a sudden starting to see in the last couple of years, something to keep an eye on. Maybe just a facility specific, maybe it's a product related. We don't know anything yet. We're just looking into it, starting to look into it. Thank you.
Okay, Samir, is there anything new with COVID-19?
Nothing new. Our cases are increasing slightly, averaging about 35 cases per day, and hospitalizations are still between 20 and 25 new hospitalizations each day for now. So I think that's the major update for now with COVID.
Samir, this is Pete. Is there any programs in place to address going back to school now? Because expectations are that COVID is going to start to increase dramatically with school starting up.
I don't think that, Robin, you aware of anything?
It'll just be clinical care from here on out. We're going to be watching COVID as we do flu and RSV, bringing it into the respiratory fold. And since I'm here and the RSV is kind of next, we will be adding COVID to the weekly lab survey for those facilities that do not participate in ELR, just so we can get a better idea of how many COVIDs there are. We will be doing school absenteeism surveillance to try to track COVID. We'll do our regular ED and syndromic surveillance for COVID. So everything that we do for RSV and flu, we'll be doing for COVID, and it will be included in our respiratory report as our third primary respiratory illness. So hopefully, and I don't know, Derek, if you had the big anything to add, but we hope to have a online interactive respiratory report dashboard active come flu season. So by October 1st. And so we'll have flu, RSV, COVID in that report. And then we'll also link to our other respiratory diseases as well. So we're going to watch it, but we won't be doing any giving out specimen collection kits or anything like that.
Thanks, Robin. It's good to hear where you're putting it on that program, because certainly we're seeing increased cases in the public health lab, and I know hospitals are seeing increased cases. So we just hope it isn't going to be something that's going to expand dramatically now that school's started.
Well, everybody should know what to do now.
Let's hope.
We've had a few years of practice, so let's put that into action.
Thanks, Robin.
We continue to do sequencing, yes, to try to detect any new strains. And so we'll keep an eye on that as well.
Okay. Thank you, Robin. So we'll move to Brianna and enteric outbreaks.
Hi, I'm going to be doing the update for Brianna today. We're currently working on a GI outbreak in Northeast Nebraska involving a tribal event. We have about 21 individuals who are reported ill with vomiting, diarrhea, and other GI symptoms. We have one stool specimen collected for a GI panel, and that came back showing norovirus, EA, EC, and C. diff. So we're hoping that we can collect and receive some more results from stool cultures that were collected and sent out to Quest. We believe it was all stemming from a specific vendor that served pulled pork at this event, but we're still investigating to get some more information and confirm all of that. So, yep, that's it for us.
Okay, thank you very much. Jeff here to talk about arbovirus.
Yes, good afternoon, everybody. Big update here is West Nile virus is circulating, in particular in the Panhandle region of the state. We've had a lot of positive mosquito pools. We're up to 112 currently. And just kind of for a frame of reference, typically we average over the last 5 years about 9 positive pools as of the end of last week. And last year at that time, we had 3 positive pools was all. So, and we're right now just kind of coming into that prime West Nile season. So I expect we'll see some more positive pools come in. And now because of that high number of positives, we are seeing a number of human cases starting to come in. Most of those still coming from the Panhandle, which since we're having most of our West Nile activity out there, not too surprising. But I will caution that we have detected positive mosquito pools in all regions of the state. So there is risk across the states as we come into our primary season here. And right now we're at 13 human cases. About half of those are neuroinvasive. We have a couple more that are under investigation. So those will be determined here later this week, probably. Once the investigations are finished. And then we're seeing our asymptomatic blood donors. We're starting to see a few of those now starting to trickle in. Got 2 in fact, today. So I suspect we'll see more of those coming in as well. So, you know, we're in the prime of West Nile virus season now, you know, right here. And I only see that the cases, the human cases will continue to go up. So that's the big thing right now.
Say, Jeff, you said there were like 6 or 7 neuroinvasive cases that you're aware of?
Yeah, about half of our cases are neuroinvasive at this point.
Are we getting those CSF sent to us for confirmation testing?
I'm not sure. Some of them have been out in Panhandle, so some of those patients have been shipped to Colorado for higher level care. So we're probably not going to get those.
Okay, because I haven't seen any yet come to the public health lab.
Yeah, most of our neuroinvasive cases are out in the Panhandle, so we might not see them because they're being transferred to Colorado for if they need higher level of care.
Okay, very good. And it'll be interesting to see now that we're entering into the West Nile virus season. I noticed on the weather maps last night that it's going to be hot and dry for the next 2 to 3 weeks. I think that environment is probably conducive for mosquitoes.
Yeah, it's already conducive for mosquitoes. I can tell you that.
But having hot, dry, standing water, I think is
Well,
something we've always
yeah,
said really
out that way. Dr. Iwan, they had a lot of extra snowpack this year, and then had some rain that kind of came through. That's kind of late spring, early summer period. So yeah, there's still pockets of standing water out there, and that's what kind of contributed to this early influx of positives. Additionally, you had to have the birds, coming through. So we probably had a pretty high infection rate in those birds as they migrated through as well, at least the ones that weren't taken out by avian influenza. So that kind of is kind of led up to where we're kind of currently at, I think.
Yeah, stay tuned, right?
Yep, stay tuned.
Thanks, Jeff.
Thanks, Jeff. A quick note here, Derek added to on RSV. He said last year at this time we were seeing atypical increase in RSV activity. Currently, we're not seeing this so far, but we're continuing to monitor RSV activity moving forward. Thank you, Derek. So are there any updates to the TB testing program? No news, no updates. How about the STD program? No news, no updates. And lead testing?
Hey, this is Brian Coyle. Sandra and Derry are away from the office today. We actually just got approved, I believe 2 weeks ago, our blood lead testing plan for the state. And so we'll be rolling out information regarding the testing plan itself, releasing a HAN, and then getting information kind of front and center on our lead website. So there'll be a lot more information and details coming in the next couple of weeks and probably a couple months.
Great. Thank you very much.
Thank you.
We're going to turn again to Emily for any updates on our LRNB or LRNC laboratory response network. Emily, anything to add?
Sure. It has been an active summer for LRNB. That's the bioterrorism rule outs. The Sentinel sites across the state have done a great job using their training from Ben and Becky for identification of potential select agents and sending them into us. We are seeing the normal unable to rule out bacillus anthracis, but we have not confirmed any of those, which is great news. We are, however, seeing confirmed Francisella tularensis. This is very common this time of year. We see it a lot, especially associated with cats, feral cats. And so we are seeing the traditional seasonal uptick in those identifications. We are also, as a state, supporting the LRNB testing for multiple other states around us. And they are also seeing their annual summer increases as well. So the LRN team here at Nebraska Public Health Lab has been very busy keeping up with all of this, but they're doing a fantastic job and getting some great experience out of it. There is no updates for LRNC, which is great because that means we haven't had, cyanide exposures or anything like that. So we like to see LRNC very quiet. Thanks, Ben.
Yep, thank you. Very good. Couple last notes here for laboratory training, the Gram Stain Challenge. We will be sending that out next week. Per our last laboratory survey, we're adding 23 labs to the laboratories that receive our Gram Stain Challenge. So quite a few going out this next week. We've got the 2 wet workshops planned. the one in North Platte on September 14th. We had a lot of people sign up for that, so we can't take any more. There's no room in the lab left. Omaha registration is still open. We'll be sending out a reminder next week. If you haven't signed anyone up and you would like to, keep an eye out for the sign up reminder. And that's it for this month's meeting. Don't forget to put your name and your facility in the chat. If there's anything else from any of our guests, I'll open it up for a minute if anyone wants to add anything or ask a question. Okay, if that's it, we'll ask the laboratorians to hop off. The DHHS people can hang around. Thanks everybody for coming. Next meeting is Monday, September 11th at noon. Thank you, everyone.